Okay, so good morning, everyone. My name is Sabrina Kofer, and on behalf of Choice, I'd like to welcome you to today's program, Elevating Nursing Education: How Libraries Can Support the Next Generation of Healthcare Professionals, which is sponsored by Springer Nature. This session is one in a series of sponsored webinars from Choice that addresses new ideas and developments of interest to the academic library community. Now, I'll just put a couple links in the chat where you can register for upcoming Choice webinars and watch previous webinar recordings. Before we get started, I'd like to point out just a few features of the webinar software. All attendees who join the presentation are automatically muted and your cameras are off, so don't worry about generating any noise or feedback. We've got that taken care of for you. In the main area of the screen, you can follow along with the presentation materials. To adjust the size of the slides or video, you can use the divider in the middle of the screen to slide the sizes to your liking. We are using the Q&A feature today. Please use it to submit questions or comments for our speakers. We'll answer as many questions as we have time for at the end of the presentation, so please do type your questions into the Q&A module as they occur to you. Also, there is closed captioning available for today's session. To toggle the automated captions on or off, please use the Show Captions button on the bottom panel of your screen. You can also turn on automated translation for the captions by clicking the arrow button, toggling on translation, and selecting your preferred language. Last, please note that we are recording today's program, and everyone who registered should receive a follow-up email with links to the recording and the slides. And with that, we're ready to get started, so I will hand it over to Wouter.
Yes, thank you very much, Sabrina. I'd like to introduce myself. I'm Wouter van der Velde. I'm Director for Book Solutions Portfolio, and I'm here also together with Yuri from our sales department. But today is mostly about what we are publishing in terms of nursing, and as a sort of celebration, when we have just launched a new ebook package in nursing specifically. But most of today is about what we are actually publishing, and therefore I'm very happy that Nathalie and Marie are here to present our from editorial what's in there. So without further ado, I would like to hand over to Nathalie, and as Sabrina said, any questions, put them in the Q&A, and we are happy to answer all of these. Nathalie, please go ahead.
So, good morning, everyone. So my name is Nathalie Villeret, and I am the editorial director of the medical book program at Springer Nature. As Wouter mentioned in this introduction, I am covering for the nursing program, and I'm covering for Nathalie Lorset-Poulin, who is sick today, and Nathalie is the executive editor responsible for the nursing program, with Marie Comgary, who will present later in this presentation. So let's begin with a quick overview of what we'll cover during this webinar. We'll start with a quick overview. We'll start with a snapshot of nursing worldwide, discuss why nursing content is more important than ever, share the vision and goals behind our new nursing ebook collection, explore what's included in our program, and finally, touch on the expertise of our authors and other endorsements that support our work. Each of these points will help you understand the value and reach of our new nursing collection. Next, please. According to the 2025 State of World Nursing Report by WHO and the International Council of Nursing, the nursing workforce is growing steadily. We currently have over 29 million nurses worldwide, and projections show that number will reach 35 million by 2030. Despite the growth, we are still facing a global shortage, and in 2030, over 4 million nurses will be missing. So while progress is made, the need remains significant. One of the most pressing issues is the uneven distribution of nurses. 78% of nurses are concentrated in countries that represent only 49% of the global population. This leaves low and middle-income countries critically underserved, and addressing this imbalance is essential. There's also encouraging news in terms of professional development. 62% of countries now report having advanced practice nursing roles. This reflects a growing recognition of nurses' expertise and leadership potential. However, mental health support for nurses remains inadequate. Only 42% of countries have provisions in place despite the ongoing stress and burnout following the pandemic. This is an area that urgently needs attention. All of these points reveal that the need for high-quality, evidence-based educational content has never been greater. Next, please. So this slide highlights a critical message. The importance of nursing content has never been greater, especially for academic and clinical institutions. The post-pandemic recovery has revealed deep vulnerabilities in our healthcare systems. This has underscored the urgent need for a resilient, well-trained nursing workforce. Beyond the pandemic, we're facing a convergence of global health threats, aging populations, rising chronic diseases, and the growing impact of climate change on healthcare delivery. These challenges demand nursing innovation and leadership. At the same time, the digital transformation of healthcare and the need for climate-responsive care are reshaping the role of nurses. Nurses must be agile, informed, and equipped with cutting-edge knowledge to meet these evolving demands. For academic institutions, this means a renewed focus on evidence-based education and training for future nursing leaders. High-quality content is the foundation for building competency and confidence in the next generation of nurses. Publishing and accessing strong nursing content contribute to improved patient outcomes, data-driven decision-making, and interdisciplinary collaboration, all of which are essential for safe and effective care. So, publishing high-quality, evidence-based nursing content is not just timely, it's transformative. Next, please. Sorry. Let me, just a minute. So let me, okay, sorry. So let me introduce to our new nursing ebook collection. Why this collection? We've made a strategic decision to decouple nursing content from the broader medicine package. This allows us to better serve the specific needs of nursing students and educators. What's included? The collection will feature 25 cutting-edge titles, carefully selected to avoid the overflow of general medical material. This makes the content more focused and relevant, aiming at meeting the true needs of university schools of nursing, especially for smaller and resource-limited nursing programs. Next, please. So, it is a qualitative and selective academic program with content authored by senior academics. It is designed for nurse readers at master's and PhD levels to cover new advances in nursing. As you can see, the graph shows the progression of nursing education and career development, starting from the generalist professional nurse at the bachelor's level, advancing to a specialist nurse with postgraduate qualifications, and culminating in the advanced practice nurse with a master's or professional doctorate. Our program focuses on nursing pursuing specialized roles and leadership in clinical practice. Specialist nurses typically hold postgraduate diplomas and masters and bring deep expertise in these specific areas of care. Advanced practice nurses go further often holding a master's or professional doctorate. They are equipped to lead, teach, and innovate in complex healthcare environments. These professionals are key drivers of evidence-based practice. They deliver expert care, often independently, by integrating advanced education, clinical training, and holistic judgment. So these specialist nurses and advanced practice nurses, like nurse practitioners and clinical nurse specialists, are our target. Our collection includes high-value titles across major nursing specialties and align with the United Nations Sustainable Development Goals. Topics include mental health, cardiology, aging, oncology, palliative care, pediatrics, disaster response, etc. We also focus on education, management research, and leadership, areas that are essential for shaping the future of nursing. So this new nursing ebook collection is more than a publishing initiative. It's a strategic investment in the future of nursing education and clinical excellence. Next, please. So who is it for and who are our authors? This collection is designed primarily for graduate and advanced undergraduate students, as well as PhD and DNP candidates. It includes a mix of 80% professional books and 20% textbooks, tailored to support both academic learning and clinical advancement. The content is authored by senior nurse academics, ensuring that the material is both authoritative and deeply relevant to nursing practice and education. Our author base is truly international, with a strong representation from the United States, 41%, and the United Kingdom, 26%. We also have contributors from Germany, Australia, Finland, Ireland, the Netherlands, Cyprus, Indonesia, Italy, and Norway. This global diversity in authorship enriches the collection with a wide range of perspectives, experience, and expertise, making it a valuable resource for nursing programs worldwide. Next, please. So nursing education has undergone a big transformation over the years, evolving from a focus on bedside care to a high-level and interdisciplinary curriculum. Our nursing ebook collection is designed to support the evolving landscape of nursing education and practice, particularly at the postgraduate level. It is tailored to meet the need of academic institutions and nursing schools, aligning with the profession's evolution and the increasing complexity of healthcare delivery. A key focus is on clinical judgment, training nurses to assess, diagnose, and intervene effectively. With the rise of telehealth, nurses are learning to conduct virtual consultations and understand the digital factors that influence patient outcomes. This includes navigating platforms, interpreting data, and maintaining patient engagement remotely. The collection also addresses social, cultural, and environmental determinants of health, helping nurses understand how these factors impact care and outcomes. Another important theme is the interprofessional collaboration. Nurses are increasingly working alongside physicians, pharmacists, social workers, and other professionals to deliver coordinated patient-centered care. Finally, we're seeing a growing trend in nursing leadership and policy advocacy. With the integration of digital health, nurses are also learning to interpret data and engage with AI tools in clinical settings, an emerging skill set that's becoming increasingly vital. In short, this collection supports the full spectrum of modern nursing, from education and clinical practice to leadership and innovation. Next, please. Our new nursing collection is strategically aligned with the World Health Organization's priorities for nursing and supports the WHO's goal of strengthening nursing education. First, it provides advanced, evidence-based content that prepares nurses to meet today's complex healthcare challenges, whether clinical, technological, or societal. Second, it promotes leadership development. The program is designed to empower nurses to take on influential roles within healthcare systems, whether through policy, management, or innovation. Third, it contributes to enhancing service delivery. Finally, the collection emphasizes digital health, clinical judgment, and interprofessional collaboration, all essential for delivering high-quality, patient-centered care. In short, this collection doesn't just support individual learning. It aligns with global health priorities, helping to elevate the nursing profession worldwide. Next, please. Our collection is also aligned with the United Nations Sustainable Development Goals, specifically goal number 3, good health and well-being, and goal number 4, quality education. To support universal health coverage, the collection addresses key themes like health equity and interprofessional collaboration. This ensures nurses are equipped to deliver inclusive, high-quality care across diverse populations and settings. On the education side, the collection promotes inclusive quality education through advanced education pathways, modern pedagogical approaches, and alignment with global standards. This makes the content relevant and adaptable for nursing programs worldwide. In short, this collection is not just educational. It's a strategic tool for advancing health and education globally, in line with the UNITED's vision for a better future. Next, please. These slides present one of the flagship components of our new nursing ebook collection, the Advanced Practice Nursing series, endorsed by the International Council of Nurses. The books in this series cover a wide range of essential topics for advanced practice nurses, including global leadership and policy advocacy, education and mentoring, ethics and research. So far, we've published 10 titles, and we are also excited about what's coming in 2026. New titles will include a global view on clinical autonomy for APN, rural advanced practice nursing, advanced practice nurse education, international frameworks. All titles are reviewed by ICN and are authored by prominent US experts like Madrian Schober, who was the lead author of ICN APN guidelines published in 2020, but with a strong international perspective, making these guidelines relevant for APNs and educators worldwide. This series is a powerful resource for professional development, helping advanced practice nurses lead, educate, and innovate in a rapidly changing healthcare environment. It prepares them to lead healthcare improvements and influence policy at institutional, national, and global levels. Now, I'm going to give the floor to Marie, who will go deeper into our program. Marie, over to you.
Thank you, Natalie. I'm now happy to dive into our existing 2025 nursing program with a selection of titles showcasing the depth and diversity of nursing education, featuring essential resources authored and edited by leading US experts. This curated collection supports students, educators, and advanced practitioners with evidence-based content and practical tools. It offers materials for student success and career transition, with practical guidance for students preparing for licensure examination and entering the workforce. The collection also develops on trauma-informed care with a framework for sensitive, trauma-aware nursing practice, and it also details advanced strategies for incontinence management. The collection also focuses on safe pharmacological care for seniors with a guide on drug use in older adults, and it offers a free comprehensive guide for oncology nurses with lung cancer navigation and care, which is in open access. It also informs on global research and interventions for addressing family violence and nursing practice. All these topics are developed by recognized US authors and editors from eminent institutions at the Johns Hopkins School of Nursing, Emory University, or the University of Pennsylvania. Contributors may also work for private institutions and practices and bring endorsement from societies. Next, please. To continue, I would like to share a broader selection of our nursing titles covering a wide range of topics. A title on preventive cardiovascular nursing offers strategies to reduce risk and improve outcomes through patient education and lifestyle intervention, while a key resource explores the future of nursing with a focus on advancing global health equity. And another book on is an evidence-based guide to menopause management, tailored to support women's health across diverse populations. Another book showcases nurse-led models of care that have proven successful worldwide, emphasizing innovation and leadership in child health. Another important aspect of nursing care is developed in a book on social determinant of health, exploring how nurses can drive change in underserved communities and global contexts. Patient safety is a recurring theme with a title linking nursing practice to safety outcomes in clinical settings. And another powerful title on adverse childhood experiences, which has earned multiple accolades from the American Journal of Nursing, delves into the neuroscience of trauma, resilience, and healing across the lifespan. These topics are brought to life by contributors from diverse institutions in the country, including, again, Emory University, the University of Southern California, or George Washington University. And among the distinguished authors featured are Sandra Dunbar, Susan Asmiller, and Jill Hamilton. Together, these titles offer rich evidence-based content that supports both academic instruction and clinical excellence, making them valuable additions to any academic library. Next, please. As we look ahead, the 2026 Nursing eBook collection promises to be just as diverse in topics and just as qualitative in authorships as previous years, with many contributions from both US and Canadian authors. 2 new titles will be added to the Advanced Practice in Nursing series that Natalie presented. One will be edited by Dr. April Capou, the Associate Dean for Strategic Partnership and Global Affairs at Vanderbilt University, which will explore clinical autonomy and will focus on decision-making, leadership, and collaborative care. The other title in the series will be edited by Dr. Kathy Wheeler from the University of Kentucky and will offer a practical toolkit for health policy implementation and improvement. Beyond the APN series, several standalone titles from US experts will cover emerging and specialized topics like pediatric neuroscience patients, management of ADHD, and even aerospace nursing, bridging clinical practice with space medicine. These works are led by highly respected professionals like Kentley Batik, clinical nurse leader at Johns Hopkins, who brings their expertise in epilepsy and neurosurgery care coordination. Ryan Kennedy, Associate Neuroscience Director of the Brown Clinic, specializes in diagnostics and treatment for ADHD across age groups. Finally, Aubrey Florence-Smith from Stanford University leads the Aerospace Nursing Project and is a recognized figure in aerospace medicine. From your Canadian neighbors, 3 comprehensive textbooks on wound, ostomy, and continence care will be endorsed by the Society Nurses Specialized in Wound, Ostomy, and Continence in Canada. And the titles will be coordinated by leaders such as Kimberly LeBlanc, the current president of the Canadian Nurses Association. Together, this title will reflect the forward-thinking, evidence-based, and globally relevant nature of our 2026 program, designed to support academic libraries and nursing education across North America. Next slide, please. So it's clear that the existing program isn't just rich in authorship, it's also diverse in scope. The available titles delve into a wide range of clinical specialties, as Nathalie already mentioned, reflecting the complexity and evolving needs of modern healthcare. From pediatrics and oncology to mental health, neonatal care, and aging populations, the collection addresses both acute and chronic care across the lifespan. Topics like nutrition and obesity or women's health are explored, alongside more specialized areas such as trauma, infection control, and neuroscience. But what makes this program especially relevant for academic libraries is its commitment to transversal themes, with titles engaging with critical issues like patient safety, ethics, and global health, while also aligning with broader framework such as the Sustainable Development Goals. We are also seeing and will continue to see a strong emphasis on diversity, equity, and inclusion, particularly in relation to health equity and the social determinant of health, while other titles explore interprofessional collaboration, bullying in healthcare environments, and the use of simulation in training. There is also a focus on research, mentoring, and the evolving identity of the nursing profession itself, as well as titles on the care of individuals with intellectual disabilities and strategies for addressing violence in clinical settings. Together, all these topics reflect a holistic and forward-thinking approach to nursing education, supporting clinical excellence and ethical leadership, inclusivity, and innovation. Next slide, please. What stands out in the 2026 Nursing eBook collection will be the thoughtful selection of topics that reflect the evolving priorities in nursing education and practice. This upcoming program will explore clinical areas that are both foundational and forward-looking. Titles will address cardiac surgery and surgical nursing, as well as stroke leadership, as nurses are increasingly taking on strategic roles in care coordination and rehabilitation. We will also see resources focused on physical examination and diagnostics, helping clinicians sharpen their assessment skills, and on allergy management, a field gaining importance in both pediatric and adult care. Mental health will remain a central theme, with titles on psychopharmacology and broader mental health care, reflecting the urgent need for integrated, compassionate approaches. Beyond clinical practice, the program embraces cross-cutting themes with topics like interprofessional education, practice, policy, and research that will be explored in depth, supporting collaboration across disciplines. One title will examine the delicate balance between safety and autonomy in patient care. Another book will focus on genomics as personalized medicine continues to influence nursing roles. And another title will discuss resilience in ICU environment, where burnout and emotional strain are pressing concerns. The 2026 program will continue to connect with global priorities through the lens of the SDGs, as titles will explore the role of arts in advancing the SDGs and the critical importance of vaccination, not just as a clinical intervention, but as a public health strategy tied to equity and access. These topics show a program that is not only clinically robust, but also socially and ethically engaged, designed to support academic institutions in preparing the next generation of nurses. Next slide, please. The 2026 Nursing eBook program is also responsive to emerging trends on areas where nursing crosses with technology, innovation, and global challenges. This year's program will reflect the growing influence of artificial intelligence in healthcare, with a title exploring how AI is reshaping nursing education from simulation and diagnostics to ethical decision-making and curriculum design. We will also see a strong focus on telehealth and virtual nursing, as the collection will include a textbook on digital health therapeutic innovation, which will be part of the Health Informatics series. Another title will examine community health nursing in the context of open governance and digital transformation. In parallel, the program will embrace a renewed interest in holistic and preventive care, with one upcoming title which will explore creative and expressive interventions in nursing, highlighting how art, movement, and narrative can support healing and emotional well-being, especially in long-term and mental health settings. The role of nursing in disaster and crisis preparedness will also be addressed in a planned 2027 publication, which will detail how nursing leadership can respond to emergencies from natural disasters to global health crises. These emerging themes reflect a nursing profession that is not only adapting to change, but actively shaping it. The 2026 program will be designed to equip academic institutions with the tools and insights needed to prepare nurses for a digital and interdisciplinary future. Next slide, please. I would now like to highlight some of the most prominent contributors whose leadership and expertise shape the quality of this program. Many of our authors and editors are affiliated with top-tier US institutions, including, as mentioned, Johns Hopkins University, Yale University, Emory, and Vanderbilt universities. Their academic and clinical leadership ensures that each title is grounded in both evidence and real-world relevance. Among them is Madryn Schober, already mentioned by Natalie, who is a globally respected nurse practitioner, educator, and consultant. We also feature Susan Asmiller, a senior advisor, member of the National Academy of Medicine, and a living legend of the American Academy of Nursing, a true leader in health policy and nursing advocacy. Also, Jackie Rolls, the president of the International Federation of Nurse Anesthetists, whose work in advanced practice education is nationally recognized. Next slide, please. Also from the US is Kathleen Brewer-Smith, Fellow of the American Academy of Nursing. Her award-winning work on trauma and resilience has earned multiple IGN Book of the Year award, making this book the most awarded book since the creation of the American Journal of Nursing Awards. In addition to our US-based experts, the collection also features a number of international contributors with high profile, whose work is shaping nursing practice and scholarship around the world. So, for example, from Australia, Professor Brendan McCormack serves as the Dean and Head of the School of Nursing and Midwifery at the University of Sydney. With over 25,000 citations and a reputation for advancing person-centered care, he is one of the most influential nursing researchers globally. From the UK, Professor Parveen Ali, who is a senior fellow of the Higher Education Academy, has recently been inducted into the American Academy of Nursing for work on domestic violence education and advocacy. Also from the UK, Professor Wilfred McSherry, internationally recognized for his research on spirituality, dignity, and aging in nursing. He is a fellow of the Royal College of Nursing. These contributors and many others bring unmatched credibility and vision to the 2026 program, making it a valuable resource for academic libraries committed to excellence in nursing education. Next slide, please. One of the key strengths of our nursing book program lies in the endorsement it has received from leading professional organizations, a testament to the quality and credibility of the content we publish. In addition to the partnership with the International Council of Nurses that Nathalie presented for the series, we are proud to partner with the European Specialist Nurses Organization on the Principles in Specialty Nursing series. Each title in this series is developed in collaboration with national or international societies as the European Dialysis and Transplant Nurses Association, the European Renal Care Association, or Authorship, the European Psychiatric Nurses Organization. Beyond the series, several standalone titles have also received prestigious endorsements from, for example, the International Continence Society or the Council of International Neonatal Nurses, the Royal College of Nursing, or the European Society of Endocrinology. These endorsements not only validate the scientific and clinical quality of our titles, they also ensure that the content reflects both academic rigor and clinical best practices. I hope you had a pleasant glimpse into our nursing book program, and I'm happy to give back the floor to Nathalie. The next slide, please.
Yeah, thank you. Thank you very much, Marie. So now I'd like to sum up the key benefits of this new collection and specifically why it matters for librarians and institutions. So early licensing of our nursing collection brings several key benefits. First, it ensures timely access to the latest research, clinical practice, and evidence-based nursing content, keeping your faculty and students ahead of the curve. Second, it supports teaching, learning, and even accreditation efforts by aligning with curriculum needs and professional standards. And third, it integrates smoothly with existing library platforms, making content easy to discover and access. What the new nursing collection will offer, our new approach is designed to better serve nursing students, educators, and professionals. We are offering a more focused curriculum, streamlining content to ensure it's directly relevant to nursing without the overflow from general medical material. This also means greater cost efficiency for nursing schools as they invest only in what they truly need. And finally, we are expanding access, making it easier for smaller or resource-limited programs to benefit from high-quality educational content. To conclude, with this new collection, we are not just offering content. We are offering a smarter, more inclusive way to support nursing education. Next, please. So thank you very much for listening to this presentation. And now I think we move to the Q&A or Wouter. Who's next? Wouter.
I think we had a couple of questions on the poll before we move into the Q&A.
And thank you, because you already, I think, answered many of them. So that was great.
Sure. Yeah, I just launched a few poll questions, so everyone feel free to fill those out. And I think we can move on into the Q&A next. And Wouter and Yuri have already answered some questions in the Q&A, so make sure to look at that as well. Okay, so let's see. We have a question that came in early on from Elise, and I think you all talked about the audience for the collection a little bit, but Elise asks, would these ebooks also be appropriate for associates level RN programs?
Yeah, definitely. They will be really relevant for this readership as well, and offers many materials for them.
Perfect. Okay, and another question came in from Maureen, and I think Marie, this was during your section while you were talking about topics covered and clinical specialties. And Maureen asks, how often will these be updated?
We usually wait, you mean maybe for second edition, if I understand correctly the question. So for second edition, we usually wait 2 years before thinking about editing the new edition. So at least 2 years between two editions of the same book.
Okay, perfect. Okay, and then we have another question here from Megan. What library platforms do you currently support?
Maybe it's more a question
for Wouter, maybe.
Wouter, if you may.
I'm not quite sure with what you mean with library platforms. However, and please feel free to type in a follow-up question on this while I try to answer what I think it is. Our books are hosted on Springer Nature Link, our platform. Access is provided by the IP ranges of the institution. All of these books can be downloaded by the patrons onto their device. We have them available in PDF as well as in EPUB, so they are also mobile friendly and can be used as such. I hope that answers the question. Other than that, we supply metadata ourselves, mark records also through OCLC, so that they can be integrated into your library systems. And if that doesn't answer the question, please type a follow-up and we'll get to that.
Yeah,
Definitely.
going to add to what Wouter was saying, we add the metadata so you can have it within your discovery system as well. So that was sort of like the follow-up to that answer.
Yes,
Awesome.
thank you, Yuri.
Thank you both. Okay, and we have a question, I think it's actually put in the answer tab, but from Lily, do you have any links or resources regarding how nurses are using AI and how these programs are changing the field? And if maybe not immediate resources, maybe Marie,
Yeah, well,
want to talk about this?
we will have title addressing our nurses will use and are already using the artificial intelligence to design their curriculum, to help in decision making. So new book in the 2026 program will be published on this topic.
Oh, perfect. Okay, great. Okay, move on to some other questions here. Let's see. So is the collection already available for sale? We've Wouter.
Yes. So yes, it's available for sale. So we're starting with copyright year 2026. That means that the first books are expected very soon. As we start with the following copyright year already late in the current year. And all of the books that Marie and Natalie have featured that obviously were published before that, they're also available as single titles. And we're also looking at if we can bundle these as well. But as I typed in of one of the question or answers to one of the questions, Our collections model works that an institution can license the copyright year of a collection. So in this case, the first one would be 2026. And as soon as books are published, they are automatically accessible. So from the moment of publication, they are accessible. And this also applies to other business models that we have, such as Access and Select, our evidence-based model, that the content is accessible as soon as it's published. And Yuri, I don't know if you want to add anything that, from your perspective to this.
No, I think you covered pretty much everything on that end. I did want to add, there was a question of the pricing, and there is some confusion sometimes. You will find, for example, in SpringLink, a specific pricing. That pricing that you find on SpringLink specifically for an end user, so for individual users. So I did post on one of the questions a link to our ebook shop where you will find a pricing for institutional purposes. And now that pricing that is there is at the per title level. So that as well.
Great, thank you both. Let's see. We have a question from Nicole, and this may be just a link, but could you please share a link to the promotional materials for this collection? I'd like to have them at our 4 upcoming local Medical Library Association conferences in October. So maybe we can put that in the chat or just answer in the Nicole's question in the Q&A, if that's available.
Yes,
And
maybe I can follow up on this one quickly. So we have plenty of material to share. So if it can reassure you, so we will follow up on this and provide leaflets and links and all kind of things.
Awesome. Okay, great. And we have a question from Karen. Are there plans in the future to create content for Canadian perspectives, for example, for our healthcare system? And maybe Marie?
Yeah, well, there will be 3 textbooks endorsed by a Canadian Society on Wound, Ostomy, and Continence, and we are always developing new approaches and new views. So projects are in discussion with other Canadian authors and contributors. So this could be maybe not in the 2026 program on top of the 3 planned textbook, but there will be a more Canadian approach in the future.
Great, okay.
And of course, this if you have feedback from your readers, students, teachers, don't hesitate to forward them to your licensing manager. This is always welcome information.
Definitely. Great, okay. Let's see, a question here. Can librarians purchase other titles from the Springer Nature Nursing Program? And if so, how? Maybe Wouter?
Yeah, sure. So apart from the models that I previously mentioned, that our collections model, as well as our evidence-based acquisition model, we also have all of our books available as single titles that can be easily obtained through our web shop that is on the librarian portal, and that can be licensed title by title as well.
Maybe I can add something if you want. So today the focus was on the 2026 collection, but we already published 240 books. Marie, correct me if I'm wrong. So around. So we have plenty of content. So feel free to go to our website, and of course you can access this kind of these different titles using the model that Wouter described today.
Great. Let's see. We have a question. What are the benefits for small U.S. institutions or nursing schools with limited resources? So the benefits of this collection.
Yeah, I'll be happy to answer if you want. So the nursing collection has been decoupled from the broader medicine package, meaning that institutions only pay for nursing specific content. So smaller schools can access high quality evidence-based resources without needing to invest in the largest medical database. So this is really the main, I think, the main benefit for small institutions.
Great. Let's see. I know you all mentioned in the presentation that the collection includes textbooks. So do the textbooks include teaching materials?
Yeah, definitely. The program so includes many textbooks, and they are specifically designed for graduate and advanced undergraduate nursing students, and they include teaching materials such as lesson learned, learning objectives, case studies, review questions, and even some titles also offer flashcards to test the reader's knowledge at the end of the book within the chapters themselves.
Great. Let's see, maybe a follow-on to that question. When you're putting the collection together, how did you decide on the proportion of 80% professional books and 20% textbooks? Did that just happen naturally, or was there a goal with that?
Yeah, well, the target being more advanced nurses, so the professional books are more often developed, but it's also it happens organically depending on the author that we want to contact and the author that we want to work with and what they want to do, what they feel the nursing field needs at the moment.
Definitely. Let's see. And I know you talked about the author makeup of the collection. So what is the proportion of US authors?
Maybe I
Well,
can.
if I, yeah,
41.
Oh, no,
I
no.
can,
Thank you, Natalie.
So maybe I can answer this one. So 41% of US authors and 26 for the UK authors. And then it's the rest of the world.
Great. Yeah. In the coming years, are there any plans to adjust that, or is that what you all were shooting for?
I think this is where the expertise is, and I maybe in southern countries they are learning advanced practice nurses, and maybe the percentage will increase over the next few years, but it will take time. And just to give you an example, because we are both based in Paris, in France, we are very late in advanced practice nurses. So France was not even mentioned on the slide because we don't have any books coming from France. But we have a series editor who is very who is very prominent in France, and he's the series editor for the ICN series, so the most prominent series that we have in our package. So it will take time, and yeah.
Great. Okay. Let's see. You mentioned some new titles coming in 2026. So maybe do you have anything else you can preview for 2026? Even just like emerging themes or other publications coming?
Yeah, well, I really browsed many of the certain publication that will come. So there will be topics, on cardiac surgery, surgical nursing, allergy, asthma, psychopharmacology, mental health, broad mental health. So really, we will span. It will really show the diversity of the nursing profession on many topics. And as mentioned, we try to focus also on the emerging trends like artificial intelligence, telehealth, and another planned title for normally 2027 will be related to disaster and crisis preparedness. So whether it be related to climate change or wars. So yeah, this is a kind of topic, a very broad topics that we will publish in the 2026 and hopefully the 2027 program.
Awesome. Okay. We just have a little under 5 minutes left. I may just go over a few of the questions that were answered in the Q&A just so they can be in the recording. So Maureen asked earlier, for those who purchased the package, are updates included? I don't know, Wouter, if you want to go over that briefly. I know you answered it in the Q&A. Oh, I think yeah.
I should unmute. Thank you. Yes, so indeed, and I think Natalie also partly answered this on, when do we provide a new edition or when do we start working on a new edition? So updates are if the content or the copyright year is licensed, then all the content is automatically available to everyone within the institution. I think that's the most simple answer to that one.
Perfect. Okay. And Amy had a question that you answered as well, Wouter. Will these ebooks be available in print as well?
Yes. And I also supplied some information there. So we have basically our model is that whenever we publish a book, we publish a file, and this file can be printed and it can be put on our platform. So any book is available as print. Then also for those who have licensed the ebook, the collection or the single title, then everyone in the institution has the option to buy a My Copy version, and that is priced at $39 per book, and it's a digitally printed a book of that, including shipping. So that is a bonus if you have the ebook collection licensed.
Okay, excellent. Let's see, a couple minutes left. Maybe Wouter, if you just want to talk about the tiered pricing available. I think we mentioned that briefly.
Yes. So the collection, if the nursing as a collection is licensed or through our evidence-based access and select model, then we price according to our tier size. And one of the factors, or there's a number of factors that we take into account to classify an institution in a certain tier. And obviously that is the size of the institution. But also the location is factored in. So that means that customers in countries with lower budgets, and that was specifically the question here, are they being subsidized? And yes, we have then they are in the lower size of our tiers that are subsidized prices indeed.
Awesome. Okay. And then maybe to finish off, Yuri, I know you answered this for just where to find textbooks that aren't open access on the Springer site.
Right, so those can be available on our ebook shop that I'm about to also put on the general text area. Something that I wanted to mention, aside, I mean, the original collection, I believe, is going to have 28 titles, but regardless, within that shop, you may search within our vast collections a series of other titles that touch the subject of nursing. So in other words, you're not limited to just those 28 that are going to be published in 2026 in this collection, but also to many more that you can purchase at a per title level. And again, the link is on the chat area for everybody to see as well and click.
Great. Okay. Okay. I think we're at about time. So thank you so much to Wouter, Natalie, Marie, and Yuri for taking the time to speak with us today. And thank you to our attendees for your great questions and comments. I'd like to remind our viewers that we did record today's program, so be on the lookout for a follow-up email from Choice with links to the recording and the slides. Also, if you have a few minutes after the presentation to fill out a brief survey, we would really appreciate it. So thanks again to all of you out there for joining us. We hope you learned something new from the session and hope to see you again soon on another webinar.
Thank you.
Thank you very much.
Bye.
Bye. Thank you.